Marissa Gay. You need
Speak in the microphone, please.
Okay, sorry, I didn't even comply with these requirements. Is there any burning questions actually to the presentation from Marissa Papaluca? If not, we have still the time at the very end, and I think this presentation, thank you, was very helpful in introducing these views and updates. So I will go to you, or just, okay. Our next speaker now will be our colleague from the other side of the Atlantic. No Brexit, you are there. And Frank Weichold had the chance, or we had the chance to meet him several times. So we look forward to your update and views from the FDA perspective. Thank you.
Thank you very much.
Okay. Thank you.
Good morning. My disclaimer sounds like the following. What I'm going to say are my own views. I work for FDA. I'm here on vacation, but I obtained the permission to talk to you and give the presentations that are containing all FDA-approved material. Now, FDA has not a particular category of non-biologic complex drugs. We recognize that complex drugs are a special category when it comes to the detail of review, and I think what I'm going to do here is construct some parallelism to some of the nanomaterials, and as such refer to a risk-based assessment and a risk-based regulation of the products, which of course includes consideration of the complexity, routes of applications, distribution, metabolism, toxicity, and the ability to characterize not only the materials but also the manufacturing processes. Quality control and post-market surveillance are very critical elements in that. We all agree that to do that, one has to build preparedness at the agency. We do that in form of special training. We have dedicated personnel, and we also have special facilities in order to deal with this. The Office of Product Quality is a relatively new office within CEDAR, a very complex and large office, and people there are very diligently interacting with the stakeholders as soon as possible, but also get feedback from post-market surveillance. We all understand that there is some need for coordination, and certainly, just like with the Nanotechnology Task Force, there are working groups that contain experts. Those expert working groups function across the review divisions. So in terms of the report structure, there is a networking between experts, and that even continues not just within the product centers, but across the product centers. And as you remember, FDA is a structure that has 8 relatively independent centers. The agency has some plan and some ambition to dedicate resources, particularly for regulatory science. But also have to be honest with you, Congress and politicians don't necessarily recognize the agency as a science and research agency. If they think of science and research, they remember there's National Institutes of Health, but not necessarily FDA. But we internally have established programs like the CHORUS program, which is Collaborative Opportunities in Research Excellence. And with that, we focus on some of the challenges and ability to build preparedness. And as I mentioned to you, one of the most helpful approaches to take is to take a risk-based assessment. And certainly the more complex drugs become, the more consideration has to be given. If we are not able to physicochemically characterize into the details, then we have to get into the details of the manufacturing process and make sure that this is consistent and reproducible. And you remember the saying that for biologics, the process is the product, and somewhat historic, but I think that applies to some of the challenges that we face with complicated and complex drugs. Certainly there are specific questions for more complex materials. For example, how does the immune system deal with such things? How is it degradable, and so on? Those are just some example questions to illustrate that certainly the agency is in tune with that, and we try to address that through our research capacities, not just internal to the agency, but also through external networking. And one of the platforms that we have developed are the so-called Centers of Excellence in Regulatory Science and Innovation, where we leverage the capacity of the best academic institutions in the world, not only to interact, collaborate with FDA researchers, but also to function as a platform for communications and the ability to very nimbly at least articulate and perhaps conjointly address some of the challenges and questions. We all recognize that platelets are often clinically a very fragile entity, and as such, of course, a consideration for complex drugs and interaction with platelets is one of the considerations and research focuses. So I don't have to reiterate the fact that if we make more complex drugs, there is usually a reason behind it, which drives that. But we also need to be able to justify the risk that we take with the complexity to get the benefit out of it. Now, you have seen this yesterday, as my colleague Anil Patri illustrated. The agency has a lot of experience with not just nanomaterials, but also complex drugs. And that is not just in the past decade. Those are just a few examples. And the point that I want to make here is not only has the field increased the amount of submissions to the agency, but I want to remind you that particularly in the follow-on or generics field, the agency deals with about 600 to 800 generic drug applications every year. And it's still increasing. We haven't reached steady state. So in a way, that's madness. And the information that we get actually in the abbreviated new drug applications is very limited. And from a regulatory, legal point of view, there are challenges to get information and request additional information. And I think that's where we need to do the science, produce the data, show the evidence, and perhaps work with the applicants to make sure the product is equivalent, appropriate, and safe. That was a bit slow. Okay. I told you that one of the ways to address those challenges is through multidisciplinary working groups. Certainly we, as you know, have a habit of releasing guidelines for specific challenges. Right now there isn't anything specific that would name non-biologic complex drugs as an entity that has a specific guidance document. But if there are specific challenges that evolve, then we will address that. And there are some examples where we have actually, where we have dedicated specific guidelines to specific categories in follow-on drugs. This slide alludes to the risk-based approach in the assessment. And here, that's what was the slide that I was looking for, are some of the examples where FDA has released product-specific equivalency guidelines. You can find those, of course, on the website, so I'm not going to spend the precious time for discussion here. If there are any questions, don't hesitate to ask. So, how do we divvy up the research priorities? This is just a glimpse into some of the focus areas. You can imagine that the more complex a molecule is or a drug is, it is helpful to have some streamlining across the review process. Certainly our policies also need to be aligned. We cannot make arbitrary or capricious decisions. And modeling and simulation certainly comes into par when we think of modern drug development. But it's also important to build a capacity that enables us to characterize very complex drugs. Specific safety considerations may come into question, particularly when it's a question how the drugs are processed, metabolized, and if there is any compartment of accumulation, particularly when it comes to material that is not easily biodegradable. Bioequivalence of drug products, not just containing nanomaterials in general, is one of the challenges, and certainly the better our understanding of the characteristics of the product is, the easier one can draw parallels and define equivalence, bioequivalence, and clinical equivalence. This all requires the expertise within the agency. Anil Patri yesterday mentioned that we have specific research facilities. I'm just showing here the White Oak research labs, as well as a quite great capacity to conduct research and analytics at the Arkansas lab in Jefferson. And looming in the background is the Office of Product Quality. So in the Office of Product Quality, there is sizable research capacity and characterization capacity that helps in the review process to make sure that the information that we get can be checked, confirmed, and we can enter into a dialogue with the applicant in case we have questions. So what advice do we give? Very similar to our colleagues from EMA. Interact early, generate the dialogue, build awareness, and get the right experts involved. Certainly there are guiding principles within the ICH and other documents. Standardization to the extent where possible is encouraged. And of course, where possible, it is helpful to develop consensus standards, because that in some cases helps us to compare apples to apples. So we continue to foster innovation and responsible development of drugs. The current review practices and the regulatory framework appears to be adequate to manage risks in quality, safety, and efficacy. Complexity of the nanomaterials is expected to increase, and certainly for that we continue to build preparedness, and part of that preparedness is dialogue. With that, I would like to thank the colleagues that have contributed and perhaps were encouraged to be here, but you know how it is sometimes in an agency. There are other pressing priorities, and as such, they sent me as the old guy to answer all the questions that you might have, and I may not be able to answer all of those, but I will take them back to my colleagues in the respective review areas. Thank you very much.
Thank you, Frank. Yes, please.
Thanks very much for the talk. You guys see many times every technology, or at its most secret and earliest phase, before many of us are even aware that technology is actually being developed. Some of those technologies fail, and they fail due to efficacy. And my question is, how can we know, as people that are developing the next generation, how can we know early on what caused the fail in one material, and how maybe we can improve later on?
Well, thank you for asking that. It's one of the difficult processes that the agency has to deal with. Because of the legal limitations and the confidentiality of the information in the application, we are not able to share that kind of information. And I completely agree with you that it would be, from a society's point of view, very beneficial to have lessons learned from prior applications. One of the approaches to take here is to work with the sponsors, with industry, to form consensus among some of the very basic criteria of, let's say, data sharing in the non-competitive space, and certainly data ownership when it comes to patient information or volunteer information, individuals that were involved in the clinical trials. The question who owns that data, to me, is a question for our legal system to address in the future in a different way than it is currently, because it hampers the accessibility of data that is very important to streamline and speed up product development. But currently, we unfortunately cannot easily share the data unless it is in a kind of a summary data, but we still have to get the approval from the sponsors.
I think it's one of the points that this NBCD group really tries to encourages. Publish as much as possible, also negative results.
Yes.
Because that really helps the field and makes and enforces the science basis of what is going on here. Because we really need more data in the public domain, not only positive but also negative data. Why are things going wrong? Why are things failing? We need to know. We need lessons learned.
I agree.
Yes.
So
Any other questions?
Just to make an additional comment in that context, the reason that I mentioned the centers of excellence in regulatory science, which are academic institutions, is the fact that I believe that we can develop a new culture in discussing and addressing the problems through those academic centers where they can form a platform of dialogue that enables all stakeholders to engage at the round table to address issues and perhaps come to better solutions than going the long route through politicians and then wait until we get instructions from Congress, which sometimes have not the best practical effect.
I just want to give a contribution.